I'm glad you could join us. We are in Santa Rosa at the Pacific Coast Air Museum. As you can see, we don't have these in our studio, so it's a whole different exposure for us. Naomi Fuchs is with us right now. She is CEO of Santa Rosa Community Health Center. It's nice to see you, Naomi.
Nice to be here.
The kind of work you do involved with the community must be quite extensive.
Yes, we provide primary care and obstetrics and mental health services to over 40,000 people from Santa Rosa who are uninsured or underinsured and low income. So virtually they have nowhere else to go for health care.
40,000?
40,000 people.
That number really does surprise me. I mean, I know Santa Rosa is a good size community, but 40,000 really.
Yeah.
Is that on an ongoing basis?
On an ongoing basis, it means we provide about 150,000 visits, medical visits a year. We have 8 locations. We have 2 large health centers, one in the Roseland area of Santa Rosa, and our newest one, the Vista Family Health Center on Round Barn Circle. We also have 2 school-based health centers, which is a wonderful model of care where the health care is provided right where the kids are going to school.
Yeah. Yeah, is the community of Santa Rosa growing that much that it needs that much help?
The city is growing itself, but on top of that, the conditions under which people are living is changing how they can get health insurance. So more and more people, even if they're employed, are uninsured or underinsured and need somewhere to go to get their basic medical care.
Yeah, well, you're right, because a lot of companies are cutting out their health benefits and so forth, and leaving people without anything at all. Really.
Anything at all, or sometimes they have a $5,000 or $10,000 deductible, and for a low-income family, that means that they still don't have really access to basic primary care.
Yeah, yeah. On a daily basis, what kind of things do you do?
So we do general medicine. If someone's sick, they have the flu or they have a cold. We deal with chronic diseases. If they have diabetes or asthma or congestive heart failure, we'll treat all of those. We have a model where each person has their own doctor. It's not just, oh, I'm sick and I see whoever's there. We want to take care of everybody throughout their lifetime, so they develop a personal relationship with their practitioner, with their physician, and then they have a whole care team that helps support them, a nurse, a social worker, things like that.
You don't want to be ill and walk in and sit at the end of a bench.
That's right.
And wait for an hour and a half
You
or 2 hours
should come see our place.
a
It's a beautiful location.
Yeah.
It's a personal relationship with your doctor, your medical assistant, your nurse. And we do ask most people to make appointments in advance. That helps with making sure that people aren't waiting for a long time.
Yeah.
But one thing that we're just about to open is a brand new health center for people who are experiencing homelessness, which is also a growing problem in Santa Rosa.
Yes, I know.
And for people who are experiencing homelessness, having appointments often doesn't work for them. So our new health center, called the Brookwood Health Center on the corner of Brookwood and Sonoma, will be on a walk-in basis. People can just come whenever they need medical care.
No questions asked?
No questions asked.
Yeah.
There'll be mental health services there. There'll be drug treatment if people need it, and a lot of supportive services. If someone's left the hospital, have they gotten their medications? Do they know what they need to do?
Yeah.
A really unique component
Okay.
of this is a respite program.
Okay, this is an amazing service, and I don't know what the costs are involved in that to a family. Let's say a family's lost their job and you know they don't really have any place to go. Are there costs involved for them?
We have a sliding scale. So the minimum cost at our regular health center is about $20 or $25. And we just ask people to tell us what their family income is. We don't do a lot of verification. We trust people. We want people to be honest.
Yeah.
But we have a sliding scale if they can't pay.
Well, your work is cut out for you. Your work is
Yeah,
definitely
there's a
cut
lot
out
to
for
do and a
you.
lot more to do.
Yeah. Naomi, nice having you here.
Thank you very much.
Yeah, I think you're really doing wonderful work. That
It's a
whole
pleasure.
organization is, you know. Naomi Fuchs has been our guest. She's CEO of Santa Rosa Community Health Centers. We're in Santa Rosa at the Pacific Coast Air Museum. Thank you very much for joining us.
Thank you.